Today we have some very encouraging news to start off with. We're very pleased with these results, and I think all Queenslanders should be proud of the mighty effort that they've put in. So today we only have 3 new cases. Now, 1 is hotel quarantine and 2 are community acquired, but they are linked to the PA nurse. So it is another nurse at that PA COVID ward. My understanding is that she was vaccinated, so I'll let Dr Young talk a little bit more about that. So we now have a total of 71 active cases in our hospitals. The number that have been acquired overseas is 58, so that's 58 out of the 71. And this is fantastic news that over the past 24 hours, there have been 33,408 tests. That is a massive, massive number. I think that's probably our highest. And I do want to thank Queenslanders for coming out and doing that. So if we see the same number of test results tomorrow, this is very, very encouraging news. The fact that we do not have any unlinked community transmission in the southeast or in our state is absolutely encouraging news. So thank you, Queensland. We are doing a great job, and together we will get through this. The number of vaccinations that were done yesterday was 6,809, and our total vaccinations since the start have been 71,942. So that is, of course, very good news. I know the Deputy Premier will have more to say about that. So as we said yesterday, from 8 a.m. today, only staff who've had their vaccine can look after people who have COVID in our hospitals. And I want to thank Dr Young for putting that mandate in place. It makes sense, and that'll be an added protective measure for our staff. I just want to confirm that we do have a person who has COVID in the Bundaberg Hospital. We are not worried about that at all. They have not been out and about in the community. And of course, Bundaberg has actually treated a COVID patient before as well. And I also want to confirm that we also do have a person in the Toowoomba Hospital with COVID, and once again they've also dealt with COVID patients before as well, and they weren't out and about in the community. So look, what is really important over the next 24 hours is simply this: if you are sick, have any symptoms, go and get a test. Absolutely critical that we rule out any unlinked community transmission of COVID in our community. But the signs are very, very encouraging, and I really want to thank everybody who's been involved in this. Our contact tracers are first class. Our contact tracers are working around the clock. Please go and check, and I ask the media, please get out again across all of your networks, and we'll put it up on the Queensland Health website, we'll put it up on my website as well. We want to make sure that people go through and just double and triple check that you have not been to any of those venues that have been listed. If you have, please watch for symptoms, go get a test. That is absolutely critical that we do that over the next 24 hours. So very encouraging news today. Thank you, Queensland.